Good evening, I'm Pat Doris. Welcome to The Story. In his excellent series, Uncommitted, our Evan Watson showed us all why there are so many people on our streets in crisis. In the opinion of many experts he talked to, the bar to force someone to get help for their mental illness is just much too high. Evan focused earlier on the greater metro area, but this problem is not reserved for big cities. Now he's back with more from a small town.
After we shared our Uncommitted series, I got some messages from people in Eastern Oregon saying, hey, this isn't just a Portland or a city problem. We see this here too. So we went there to learn how state standards for civil commitment are affecting mental health care in rural parts of the state.
Morrow County, most people don't even know where we are. Population of about 13,000. This is a county and community that, they care. They care for each other.
Nestled in the dry hills of eastern Oregon sits the city of Heppner. While it's easy to spot differences between Heppner's Main Street and Portland's own, when it comes to severe mental illness and civil commitment, there are similarities.
That's not a Portland issue. It is a statewide issue.
Justin Nelson is the district attorney for Morrow County, a county filled with farmland, with a population that's largely white and Hispanic. Nelson handles civil commitment cases from the historic courthouse. He's one of the state leaders who emailed KGW after seeing Uncommitted, saying high state standards for forced mental health care directly affects residents and families in rural places like Morrow County, where he grew up.
The person might decompensate so far that they get to the point where they don't think they have any problems. They're not the same person anymore that their family remembers.
To compel mental health treatment in Oregon, evaluators must determine a person's mental illness is an imminent danger to themselves or others. Our series explained how very few people with severe mental illness meet that standard. Nelson and others say the bar is too high to help people who really need it.
It's not enough to say, okay, there's railroad tracks right here. That's my plan. I'm gonna go to the railroad tracks, lay on the tracks, and have the train run me over. Court will say that's not enough. Okay, well, I have a plan for a day. The train comes on this time. That's when I'll go out there. Court might say that's not enough for an imminent threat to harm. It is the person being out there, laying on the tracks, and the train coming at you. That is the imminent harm to self. I don't think it's appropriate to wait until that person's on the railroad tracks with the train coming at them before you scoop them up and save them. You should be able to do it sooner.
Heppner is just one city in a large eastern Oregon area that Linda Mills covers. She's worked as a mental health investigator for more than 30 years. Mills says people in these rural communities understand that civil commitment cases aren't restricted to the bigger cities.
You do not believe that if you live here. That it's an acute problem here.
And people know.
And people know.
Have you seen or worked with people who might be brought in and then are released and then you're called to work with them again?
Oh, yes.
Frequently.
Over and over and over again.
She says even though mental health resources are often farther away, her hands are tied when someone refuses care.
It's sad that all the gains we've made in knowledge about mental health and how to intervene and how to help people, especially in the last 20 years, that we can't do that to the people who need it most. And so much of the time when they do finally get treatment, they'll say to me, I wish somebody would have been able to force me to do that. One of the saddest things sometimes is people remember their psychosis and they know they needed help.
As Nelson also prosecutes criminal cases, he says he knows people who didn't meet state requirements for forced mental health care who quickly ended up in jail.
And so we're waiting. We're waiting for them to commit a crime before we can help them. That seems wrong. I do believe we have defendants that if we were able to get the treatment ahead of time, they would not be part of the criminal justice system right now.
Nelson says the answer is expanded access to civil commitments through lowered state standards for forced care. He went to the state hospital and other facilities to see what this process is like.
You can get the idea, I think, of the back in time, a person can be committed for anything, right? And that, it's too easy for someone to get committed. They get in the state hospital, the key gets thrown away, and they're just stuck in the system. I can just say, that's not the experience we have here. They try to move people down to a lower level of care as soon as possible.
Mills says changing state laws would help address this increasingly serious problem.
Well, it's led to a huge population of mentally ill people who are not receiving the treatment they need, and the treatment, if they were lucid, that they would want. Lately, I tell family members who say, "You're not doing enough," to please write to your legislator. Please write to your legislator. We want to be there.
Evan, what was access like out there for folks? Were they able to get in for the treatment that they needed?
Well, a lot of the people I talked to in this area in Morrow County, they said they have some great outpatient facilities if someone's looking for something for a day evaluation or what that may be. But when they're looking for a bed or some kind of long-term care when it comes to civil commitment, that's harder to find and often farther away. And for example, if they're looking for something in Portland, as Pat's talked about this week, with not many beds available at the state level in the Oregon State Hospital, if they're waiting on something in Portland to open up, if someone comes into a Portland hospital, that often bumps them down further down the list. And so that can be really challenging.
Yeah, and frustrating. Plus the families have to make the long drive into Portland, and yeah, hopefully we can figure something out with that. What was it like for you going out there? Were people happy to see you, or were they like, look out?
They were. A lot of people were super friendly, both in Heppner and the other places we visited in the county. Although I will say, when we tried to talk to some people who have experienced some mental health problems themselves, some families, some people who were recommended to us, no one really decided that they wanted to go ahead and share their story publicly like that. So that could stand to point out the stigmas around this topic as we work through it and as we learn and understand more of what's going on. But regardless, many of the people there who were really invested in how mental health and how treatment works, still pointing those civil commitment standard issues that we've talked about for a while now.
Yeah, a lot of great people out in Heppner, but you don't want to be the one that stands up and says, hey, I've struggled with mental health.
Could be.
It does show you how we've still got to work on that stigma. Thanks, Evan. Great reporting as always.
Thanks.
By the way, if you missed one of Evan's Uncommitted segments, you should catch up. The series is available right now, and you can stream it on KGW Plus, our free Roku and Fire TV app. You can also find segments on the KGW YouTube channel.